Welcome to another episode of China Update, where I provide you guys with the most up-to-date political, economic and geostrategic analysis on the world's number 2 economy. My name is Tony. Let's jump in. Okay, happy Wednesday everybody. Officials in several regions and cities across China are beginning to announce that their respective localities are reaching or passing peak COVID cases in the first of this massive wave. For example, on Monday, a health official for Henan province said that cases had peaked and that 89% of the people in the province, or over 88 million people, had been infected. Yesterday, Tuesday, city officials with the southern megacity of Shenzhen also announced that cases have already peaked in the city. Now, these authorities have not provided reliable data to back these claims up, and in some cases, no data at all. There are also political temptations to make such claims, so we should take these assertions with a grain of salt. However, in saying that, there is also reason to believe, based on alternative data points like economic activity, for example, and anecdotal accounts, to suggest that several regions, especially the major cities, have indeed passed peak cases in this first wave. Zhang Wenhong, the prominent and outspoken head of the infectious disease department at Huashan Hospital in Shanghai, also director of the National Center for Infectious Diseases, expressed this week that the first infection peak has passed in many Chinese cities and that the second wave of infections is estimated to reach its height between May and June this year, adding that during the second peak, 25 to 50% of people may be infected with milder symptoms. However, this first wave is not over for much of the poorer interior, now bracing for this COVID tsunami. Quote, "There's a lot of attention focused on how Beijing and Shanghai are struggling, as if they are seeing the worst. But that's really drowning out what's going on in lower tier parts of the country. The peak in infection and severe disease is yet to hit rural areas, and a big problem awaits down the road." End quote. Chinese state media, perhaps betraying a shared sense of concern for some rural areas, have produced articles this week criticizing foreign media and arguing that poorer regions are doing well. Quote, "Some Western media ignore the facts, choosing instead to apply double standards and even spread misinformation while making unwarranted accusations against China's epidemic. A foreign media report alleged that there would be a dark COVID winter for Chinese villages. The truth is, China has made rural areas a focal point in the country's current COVID response, boosting medical capacities and providing timely support." End quote. In a separate article, the state-run Xinhua also boasted, quote, "China has managed to keep its severe cases and death rates of COVID-19 among the lowest in the world, deliberately distorting and adjustment of China's anti-COVID-19 policies highlights the double standard and hypocrisy of some in the West." End quote. Adding, quote, "If China's COVID-19 response failed, what about some countries where the death toll far exceeds that of China?" End quote. Of course, as we know, many global experts, including top officials with the WHO, have criticized Beijing for not publishing accurate data on COVID deaths. Currently, we only have anecdotal reports to guess what death rates could be like. For example, the US-based Washington Post writes yesterday that, quote, "Satellite imagery, first-hand videos posted to social media, and witness accounts suggest that China's COVID death toll is far higher than the government's tally." End quote. Other commentators have been more critical in their articulation. Quote, "China was so proud of its COVID control measures until spring of 2021, but look at it now. Everything has fallen apart and its pandemic response model has become a laughingstock. This is going to affect not just the leaders, but the legitimacy of the regime itself." End quote. Many of the costs of this first wave are now increasingly falling on households. For example, the UK-based Japanese-owned Financial Times writes yesterday that at least 14 Chinese cities and provinces have stopped providing free treatment for coronavirus after Beijing rolled back its zero-COVID strategy last month. For 3 years, it points out, Chinese patients had received subsidized care for the virus. Hospitals in Shanghai and Guangzhou, quote, "are instead charging COVID patients with severe cases up to 20,000 RMB, $3,000, about 5 months of income for an average urban resident per day for intensive care, adding fears of onerous medical debt to the risk of infection." End quote. adding that insurance companies, quote, have been reluctant to approve COVID-related claims after previously selling tens of millions of low-cost plans as the industry seeks to avoid liability for enormous payouts during an exit wave of cases, end quote. Hey guys, if you're enjoying this episode of China Update, don't forget to hit that like button, it's a massive help. For those who are not subscribed who enjoy the episode, maybe consider subscribing. And as always, anyone who can go that extra mile and be part of the community that keeps this channel going, Patreon and Buy Me a Coffee links are in the description below. Thank you so much everybody for the ongoing support. Okay, next up, Beijing has begun retaliating against some of the many countries which, as we have seen in recent weeks, introduced mild restrictions against inbound PRC travelers. We remember that since Beijing announced that it would open its borders, countries, beginning with Japan, Italy and the US, and then quickly spreading to dozens more, out of concern for a surge of cases and perhaps even new dangerous variants from recently affected PRC travelers, have introduced restrictions these last 2 weeks. The restrictions mostly require travelers to pass a COVID test. We should note that when travelers return to the PRC, they also need to provide a COVID test. However, some countries like South Korea also limited short-term visas to PRC citizens. In response to these measures from countries around the world, People's Republic of China Foreign Ministry spokesperson Wang Wenbin expressed, quote, regrettably, a handful of countries, in disregard of science, facts, and their actual epidemic situation, have insisted on taking discriminatory entry restriction measures targeting China, end quote. Yesterday, Beijing announced that it was halting the issuance of visas to South Koreans and Japanese due to their, quote, discriminatory COVID-related travel measures, end quote. The same day, Japan's foreign ministry lodged an objection with the PRC embassy in Tokyo. A senior Japanese government official speaking to Japanese financial media outlet Nikkei Asia expressed, quote, Japan has not blocked travel from China. This measure is completely out of proportion, end quote. The Chinese embassy in South Korea announced on Tuesday that its suspension of short-term visas to South Korean citizens, quote, will be adjusted depending on the cancellation of South Korea's discriminatory entry restrictions against Chinese citizens, end quote. One Chinese academic speaking to Hong Kong-based media expressed, rather frankly, that these retaliatory measures from Beijing are a matter of face, and that any reciprocal measures would be considered in the context of China's bilateral relations with different countries. Quote, the Koreans are the neighbors. South Korea's economy relies heavily on China, so it seems that the Koreans are easier to target. There is a considerable difference in China's tolerance for the actions of different countries. China will only take countermeasures against the United States when it does extremely bad things, but will target South Korea when it only does a little, end quote. We remember back in 2017, China dramatically scaled back its trade with South Korea after then President Moon agreed to host a US anti-missile system, the so-called THAAD. As we know, the EU has restricted inbound PRC travelers as well. Yesterday, the WHO Europe Regional Director told media that currently they could see no threat of dangerous new variants from China, though he admitted this conclusion is based on insufficient information and data. Now, one last thing while we're on this theme of reopening. Chinese financial media outlet Retaliation published a great report yesterday asking the $100 billion question, how quickly can cross-border travel return to pre-COVID levels? The outlet writes that in a very optimistic scenario, international flights to and from China could return to frequencies not seen since 2019 by this summer at the earliest. That is, the Northern Hemisphere's summer. The writer cautions, however, quote, this prediction comes with some caveats, including how quickly airports can get security staff and protocols back up to full capacity, and airlines can bring pilots and cabin crew back to speed, not to mention how the COVID outbreak nationwide will tamper the recovery in demand, end quote. These last 3 years have been devastating for the industry. The outlet points out that the total accumulated profit of China's civil aviation industry from 2015 through 2019 was as much as $23.5 billion. But, quote, by comparison, the industry lost nearly twice as much during the 3 years of the pandemic, end quote. Okay, that is today's episode of China Update. Thank you so much, everybody, for watching. Have a wonderful day wherever you are, and I will see you all tomorrow.